So welcome to This is Getting Old. I'm your host, Melissa B., PhD, and I'm joined today with Amber Carroll from Well Connected, and that's what we're going to be talking about today. So welcome, Amber.
Thanks for having me, Melissa.
So tell me a little bit, introduce yourself so that we can get to know a little bit about you and your background and how you came to work for Well Connected.
Sure. So my name is Amber Carroll. I'm the director of one of Covia's community services. Covia is a nonprofit organization based in Northern California. And in addition to senior housing, we have a robust suite of community services. So I'm part of that division. I'm going to be talking about Well Connected today. And I've been in aging services for going on about a decade now. I used to be a marriage and family therapist, and I really thought my career was going to be with children and families, but really found my home in aging services.
Well, and older adults tend to have family and kids, so
Indeed,
just a little farther down.
I was just working with younger ones, yes.
Yeah. So tell me, what is Well Connected? Because I had not actually heard of your organization. You contacted the Center for Aging, and I started looking at your programming. I was like, this is like such a great resource. So I just wanted to share it with everyone. So tell everyone what Well Connected is.
Well, thank you for sharing it. I'm certainly biased, but I think it's the coolest program ever. We're a phone-based activity program for older adults. So we started back in 2004, really as a grassroots effort to connect 6 individuals living in the Bay Area. These were folks who, because of mobility issues or other medical reasons, just weren't able to get out as much as they were used to. So we put together a conference line in 2004, serving 6 people, and now we're up to over 1,500 people joining us from across 46 states. So folks can call in from the comfort of home using any telephone and join into lifelong learning opportunities. They can join into support groups, games, chats, pretty much anything under the sun that people have interest in. We have done or will do a group on it.
Okay, so people call in through their landline, and you had mentioned, doing like support groups and things. So what are some of the different types of, we'll kind of start with that, maybe we'll just break down like each one. What types of support groups do you have?
So I would say a lot of our support groups, we have a number of support groups for folks who are low vision and blind. And if you think about folks who might be interested in joining activities and continue lifelong learning from home, we have a much higher percentage of participants in the Well Connected community who have vision impairment. If you think about the first thing that happens when you lose your vision, usually the loss of your driver's license comes with that as well. So we have a lot of low vision and blind support groups. Some are peer-led, some are professional-led, chronic pain support groups. And because all of the programs on Well Connected are led by trained volunteers, a lot of the groups really depend on who we can find volunteers for who are interested in doing that. So we've had diabetes support groups in the past, all kinds of things.
So what about Alzheimer's support?
So Alzheimer's support, we've done more health and wellness programs specifically around memory loss, Alzheimer's, and other dementias. As far as a support group, that would be something we'd be really happy to have. We can talk about some accessibility issues around people with memory loss. We're really working hard to make our program and our conferencing system a lot more accessible to folks who have memory loss to be joining our groups, which includes the ability to call people into groups at the time that they're happening. So this is something new that we're launching into just this session.
Okay. And I was actually thinking more from the perspective of the caregiver, but either way. So are these support groups so it's smaller? Because I think when I call into like a webinar, sometimes there could be like 100 people on there. So would you sign up for that group and then you kind of manage a smaller group?
So that's a great question, because as this program continues to grow, our core mission in starting this program was to connect people. It was really about people being able to socially connect to each other. So as much as we want to grow and scale this program, we don't want 100 people on a support group. That's just too many, and that really takes away our core purpose of engaging people. So what we do is we're in really close contact with our facilitators. So we really just keep an eye on the size of the groups and keep in contact. So I would say our average group that people are calling into is probably about 8 to 10 people, which is really a very manageable and great size for group dynamics. If the group starts to get too big, what we're probably going to do is add a second group to that. We've been fortunate that we haven't had to limit the number of people who can join a group, and people can join as they're interested. But yeah, we want to keep an eye on things to make sure that engagement is still possible. We do have another kind of circle of groups, which are more of our lifelong learning opportunities. Those groups are additionally moderated by staff, and we can accommodate a lot more people. Those are a little bit more lecture based, although still with room for questions and comments and interaction.
Okay, so you mentioned peer reviewed or peer led and or like professionally led or staff kind of moderated. So it sounds like that you're open to topics, just someone with that interest just kind of approaches you and you can do that for them.
Absolutely. And I mean, we try. I have to say, we get everything we do is done with the input of our community. So, you know, we got input a few years ago that we needed to have more celebrities on our groups, and we haven't quite been able to provide that. We're trying. But we also, I would say about 80% of our content on Well Connected, and I should also add, we have a Well Connected Espanol program. So between the two of them, there's over 100 groups going on every week, 365 days a year. About 80% of all of that is led by our participant community. So we're really leveraging the skills, the time, the passion of the people in our community to facilitate groups of interest.
Right. So it sounds like even though people may be homebound, you wouldn't necessarily need to be homebound. It's also about kind of, maybe it started off that way, but it's really about kind of social connection and
Right.
finding people that have similar areas of interest that you do. So if I heard this podcast today and I was like, oh, well, I would like to be able to, and is it only phone based or or is it some of it computer based so that you can see each other?
So currently we have all of our programs are accessible by phone. They will continue to be that way. We're currently using Zoom, the same platform we're using right now for some of our online groups. Those include usually more of our lifelong learning groups, things like museums at home, which my personal favorite, we partner with museums all around the country to do docent tours. Tomorrow we'll be doing an architectural tour of Chicago. That group involves handouts, so people who are joining online are going to be doing what we're doing or what viewers of the podcast are doing, which is watching a screen of images. For folks calling in from home, we actually mail a handout. So while people are on the phone, they can follow along with the images that are happening in the presentation. We're developing a new conferencing system. We are in the throes of fully rolling it out this spring and summer sessions starting in May, which will make everything we do accessible either by phone, and that means any kind of phone, or online. So people can really join wherever they're comfortable and whatever's the easiest way for them to join.
So yeah, the museum part I want to come back to, but if someone wanted to join, is it like a membership base? Do you have a website that they could go to get more?
Yeah, so more information, you can go to Covia, Covia.org. For more information, there's a link to our current catalog. We register members for the group. It is free to individual participants. So, so most people simply call our office and talk to a live person who will get them registered for the program. We'll put an envelope in the mail with our current catalog and all the information they need to get started, and then go from there. People can really pick and choose to join whatever groups are of particular interest to them and fit into their schedule.
So it really doesn't matter where you live in the country. You can become a member, which is free. And then if you have an idea for a topic or anything you would like to do, just touch base with you guys and see what can be done.
It's that easy. Yeah. As much as we grow, we're still a really high touch organization. So folks can call and talk to a person and give feedback and anything they're interested in. So we really try to meet the needs of the community, and we access the community to meet those needs.
So we kind of talked about the support groups and how that works. So let's go back, because your catalog is like multiple pages. It was like so much so that I didn't want to print it. But I think that the museum tours, that was like 4 pages. So maybe tell us a little bit more about that. I was interested in that from kind of an arts and creativity perspective. And now that I understand a little bit more about how that works, even better. So just tell us a little bit more about those.
Sure. This started before my time with Well Connected. We had a partnership with the Oakland Museum of California. So they provided a docent tour every session of a current exhibit.
And this was that word you're saying is dose and cure?
Docent tour.
Oh.
So docents are the people who do the museum tours on site. So the docents now do the phone-based tours.
Okay.
So this idea we really built off of from the Oakland Museum, and started reaching out to museums all over the country. And it's really interesting. Again, everything in this program seems to get back to accessibility. So in contacting museums are doing amazing things in the arena of working with doing dementia-friendly programming and doing online programming. So very accessible in those 2 ways. There's a huge gap though, and what's being left out are people who aren't able to get to the museums for these dementia-friendly great tours and don't have internet access to engage in the online programming that's very accessible. So a lot of the well-connected community falls somewhere in the middle. So it's people who aren't able to get out, but also don't have that technology to access a lot of great programming. So we're really working with museums who are interested in providing content to that big population of older adults in this community. So, I have to say one of our greatest partners is the Art Institute of Chicago, who's just really dialed into accessibility on all fronts with their programming. So our partners now are the Art Institute of Chicago, the Miller Institute for Contemporary Art in Pittsburgh, Pennsylvania, all of the museums pretty much in the San Francisco Bay Area. We've got the Fine Arts Museums of San Francisco, the Asian Art Museum, Contemporary Jewish Museum, the MoMA in New York, just a bevy of great museums that bring their current exhibits. And in some cases, we have docents who create specialized docent tours about things they're particularly interested in, and bring these customized docent tours to Well Connected.
So if a museum or somebody that works there at another museum that's not already on your list, is it the same process for them if they wanted to be included?
Yes, we will take we're interested in really spreading the museums and making that even more available. It's really one of our favorite groups of participants to join. They get pretty big numbers. We also offer some of those groups up as group activities in senior housing communities and senior centers and things like that. So folks can kind of plug into that activity as a group, which is a really fun way to engage a community that is actually convening together to watch a museum tour. And we do these all the time, hang around afterwards and discuss it as a group live.
Yeah, that's interesting, because I actually went to something similar to that, where there was one like central meeting that was like the live event, and then you had all these satellite kind of breakout sessions where people were in like a physical room together but watching the event, and then they would have it kind of broken up with speakers and things like that. So it was a really nice kind of blend.
Right.
Like, I'm physically here with people, but we're having a joint experience online, but then we can have discussion afterwards.
Right.
And so that works really well, like for people that do have access to the internet and the technology. But I think that it's really great that even with the phone calls that you send a packet that says you can still call, call in. And so
Right.
there'd be a way to do that even for within like a small group of people that called in.
Mm-hmm. Yeah, we can to get handouts to them so folks can follow along.
Right. So the handouts, and then like being able to, you could follow along on the phone, but then in your group phone chat,
Right.
have that discussion so that it's still accessible if you can't be there or you don't live in a community of other people, but you could still kind of
Absolutely.
do that as well.
Absolutely. And a good example of that is, in addition to our regular programming every day, we do an annual creative aging symposium that just happened this last January. So 2021 in January will be our 4th annual creative aging symposium. This has been a really interesting process. So we have a half day of a symposium where we bring together world-class speakers in the arena of creative aging, and we're doing in the spring summer session upcoming a follow-up to that. So exactly what you're talking about, we have this sort of day of programming, but we want to keep that conversation going. So we're going to be doing a follow-up, bringing in some of those speakers again for follow-up, and certainly our moderators will be talking to a group of people to really keep that creative aging conversation going.
So maybe that's where the celebrities come in.
That's where actually that is exactly it. We did have a few. We have certainly had celebrities in the creative aging world come in to do symposiums. We haven't had Brad Pitt yet.
Okay. Well, we can keep our fingers crossed.
Right.
So in addition to support groups and kind of these museum tours and the creative aging symposium, what are other, I think you had mentioned games to me before.
Mm-hmm.
So what are some other options?
So definitely games are a big one. We've got, we had a Trivial Pursuit, we have trivia, we have lots of different kind of word games. The requisite bingo in Espanol, we've got Loteria. And then I would say across the board, our number one top-notch favorite group that's been going on for about 12 years now is Gratitude. And Gratitude is so popular, we do it 14 times a week on the English program. We do it 3 times a week on the Spanish program. And simplest thing ever, where people come together on a conference call and really sit around a virtual table and everyone shares one thing that they're grateful for just at that moment. It is possibly start every day with gratitude, and I can't think of a better way for anyone to start their day. It's a beautiful group.
Okay. So any other programming or things that listeners should be aware of?
So I think, some of the other ones that we do, another really fun one and very popular is armchair travel. And we ask people to share vacations. So especially for our community, folks who aren't traveling as much anymore or at all anymore, armchair travel is a really wonderful way to see the world. And also it brings about such wonderful conversation. We just did a recent tour of Paris, and so many people in our community have visited Paris at one point in their lives. So there's all this wonderful memories and stories and anecdotes that happen from everybody else on the call who might have visited that same place or seen that same thing or asked about if this restaurant is still there. So that is a really fun group for eliciting stories. Health and wellness is our group that really brings a lot of information to people about all kinds of things. You had asked about our dementia-friendly stuff. We did a series with the Alzheimer's Association. This session, we do a lot of brain health sessions, and lots and lots and lots of arts programming, whether that be literature, movies, music, fine art, storytelling, name it, lots and lots of arts programming.
So I have a quick question, because what this actually makes me think of is this, you don't have to be 65 or older to join.
We consider a senior in this program to be 60. We do make exceptions to that. It's really about being a good fit for the program. But I would say our average age is somewhere in the ballpark of about 74, I believe, is our average age.
Okay. Do you do
I
any
apologize. Sorry, we've got sirens going.
We'll wait for that to pass.
Okay.
So my thought was, like, so people that do it like homeschool, like, you know, I'll just go ahead and ask the next question. So, so are there any opportunities for intergenerational like programming? Or
There certainly is for volunteers to lead groups, and I have to say that's been one of the requests of the participant community, is to do more intergenerational programming. We've done that in partnership with Roger Annenson, is a geriatric professor in Washington State. He's done a number of groups with us. He does a lot of our brain health work. And he's brought in his students to do a lot of programming for us in past years. We did an armchair travel with an 11-year-old, and his mother led an armchair travel for us. So there's certainly opportunities. We run into some problems simply with younger people doing that, because so much of our programming happens during the school time. But it would be nice, and we've gotten requests for younger people to come in and do sort of an interview style, to talk to the older adults and really have a group where there's that conversation going.
Yeah, it makes me think about, you know, grandparents, you know, or even like a grandparent connection. So if you had college kids that were interested in kind of making a connection with an older adult, or doing an interview for a class, you know, as a professor or associate professor, I could see having, you know, trying to create something where students interviewed the older person either through Zoom or by phone, just to kind of practice communication strategies, but then also kind of some legacy type of work, where with the armchair travel, if they went to Paris, and that's what the topic was, has the younger person been kind of what?
I love that idea, and I would love to have access to all your students to do that. We do, Well Connected has a sister program. It's the other, Covia has 3 national programs, or programs with national footprints. So our sister program is called Social Call. That's what started as a traditional friendly visiting program. We have spread that program virtually as well. So that program has a lot more intergenerational, a much bigger intergenerational component to it, where we match one individual with another individual for weekly phone chats. Traditionally, when it was a live friendly visitor program, and it still is in a few counties in California, it was highly intergenerational. It was usually a younger person wanting to volunteer to visit an older person in their home. What we've noticed as we've spread that out to be a virtual program is we're getting a lot more peer matches. So again, it's a perfect opportunity for older adults to volunteer from home to connect with another individual. So Well Connected and Well Connected Espanol connects individuals to groups, and Social Call connects individuals to individuals. But Social Call still has a higher percentage of younger people connecting with older people in that one-on-one dynamic.
Yeah, so I think what's really also great about your program is that you are not just a passive participant or a member. There's the opportunity to be creative and for it to be more engaging for you as a leader of a potential group. So
absolutely, and that's such a core value of what we do. I even have a hard time thinking of us as a program. I think of us more as a venue in which genuine connection can happen, and I get to watch that happen every day. It's a lot of people don't understand how community can be established virtually, but you know, I think the key is we use technology as a tool for that to happen. We're not considering technology to be the solution to that happening. So technology is just a venue by which people can be people and can connect to each other and like each other and, you know, continue relationships through this program and sometimes outside of it as well.
Yeah, so in education, that becomes an issue, or it's been in conversation for a while. So I did my PhD in online programs. So I was working and living in North Carolina and going to school in South Carolina, and still felt very connected to my community in Charleston. We would go there, you know, for a week in the summer where we saw each other together, but then we took classes, you know, completely online. But, you know, what I found to be fun is you could even still pass notes, because you could be like in your class and have like Skype open on the side and having this kind of, you know, back and forth. And I was like, you know, back in the day that would have happened, like the little sheet of paper that you folded up and passed and you got taught by your teacher. But yeah, there is a way to feel, you know, it's not a traditional way, but I do think that this program is something that could be very valuable to someone emotionally who is maybe home alone by themselves more than they would like to be.
Right.
So if you were, because a lot of older adults don't have mobile phones, access to the internet. So if you were going to call in, do you send them a catalog? Like, how would they find out when these things were happening?
Right. So the packet that goes out once you're registered is a current catalog. We do 3 sessions a year, so we're on a trimester basis. Every session, once you register, you are registered for life unless you tell us differently. So every session you're going to get a new catalog, a participant calendar, and that's really the holder of all the information. So the catalog has the dates of the groups, the titles, and the descriptions. The participant calendar has the times, and we offer those in all 4 time zones. So wherever you live, you're going to get a calendar in your time zone, and has all the call-in information. So here's the number you dial. Like I mentioned, in spring, we're going to be rolling out our conferencing system across all of our programs. So every single phone call can be accessed with the same telephone number, which is a toll-free number, and a 2-digit conference code. If you let us know in advance that you want to be called into, you know, Poetically Speaking every Wednesday at 2:30, we can arrange to have you called into that group every week. So for folks who are getting called in, they're simply going to get a phone call that says, you know, "Hi, Melissa, welcome to Poetically Speaking," and then you're there. So that, and then an activity checklist. And we use the activity checklist for a couple of reasons. I mentioned some of our groups have handouts. So for the groups who have handouts, we don't want to mail them to all 1,500 participants if not all 1,500 participants are joining. So if people want handouts to groups, we ask them to let us know which groups they'd like handouts for. And for folks joining online, that involves an email invite to every particular group. So if folks want to join online, they need to let us know which groups they want to join online so we can send an invite.
Okay, so one thing that just occurred to me, we gave people the website information, but if someone is listening to this and they don't have internet access, what's the phone number that they can call?
Accessibility. The phone number is 877-797-7299.
Okay, so people can call that number, or they can go to your website, be connected to you, join for free, and then they'll get something in the mail, or they can check out online how all of the things that they're interested in.
Absolutely, absolutely. And I don't think there's a person on the planet who couldn't look through the Well Connected catalog and find something that is that's of interest.
That's true. I would agree with that. So, all right. Well, any last thoughts?
I really appreciate you reaching out and having me on your show. This is really fun, and thanks for spreading the word. We really want to get this idea out to as many people as possible. We realize it's kind of a hard concept to grasp, that you might, you know, play a game over the phone without seeing other people in that group. But once people catch on to it, it's such an amazing and beautiful thing. So thanks for sharing.
Yeah, and I think that we had in my overview, I talked about the impact of social isolation as people age. You know, being isolated in your home by yourself every day, day in and day out, is like smoking a pack of cigarettes a day. So I thank you for having a program that helps people get connected and, you know, have some outlet where they can interact with other people. So thank you for all that you're doing.
Thank you so much, Melissa. I appreciate it.
Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.